Do you get sciatica when driving? Whether sciatica stops you from taking long road trips or whether it bothers you just driving around town, the tips in this video will help you out. Now, first of all, what causes sciatica when driving? When you're driving and sitting with your leg out extended like this for long periods of time, that puts your sciatic nerve on tension. Now, your sciatic nerve attaches to your spinal cord, and your nervous system is continuous from your brain down your spinal cord all the way down to the tips of your toes. So when you're sitting in a 90-degree angle like this with your leg extended, it puts your nervous system on a maximum tension position. Now, your nerves need three things to be healthy. They need space to move, so they can't be pinched or compressed. They need movement, and they need blood flow. And when you're sitting stationary in a position for a long period of time, you're not getting a lot of movement, and that decreases blood flow. But furthermore, if you have something that's pinching the nerve in your lower back, that tugs on the sciatic nerve as well. Now, that can be various things. It can be a bulging or herniated disc, or it can be decreased space between your vertebrae from degenerative disc disease or spinal stenosis. Now, younger people tend to have more of the herniated disc problems, where flexed or rounded positions of their lower back tend to bother them more and can put more pressure on the discs. Older people over the age of about 40 or 50 tend to have the opposite problem, where they've lost some space between their vertebrae, and that narrows the spaces where the nerve roots that make up the sciatic nerve come out of their back. As a result, sitting with too much extension in their back often causes older people to have sciatica when driving. Now, paying attention to your position of both your back and your leg can help relieve tension off of your sciatic nerve when you're driving. Now, how much lumbar support should you use? Well, the lumbar support is meant to do exactly that. It's supposed to support your lumbar spine or lower back. So you don't want it pushed out so much that it's creating extra arch or extra extension in your back. That can further narrow the spaces where the nerve roots come out, especially again if you're over the age of 40 or 50. Conversely, if it's all the way out and you're flexed too much, that can create extra pressure as well. Now, varying your position while driving, for example, just kind of moving your back between different positions, or even doing sort of an alternating pelvic tilt exercise like this every now and then when you're driving, can actually help get some movement and blood flow, which is, again, good for your nerves. Additionally, you want to pay attention to the side-to-side and rotational position of your spine and of your pelvis. As you're sitting with your right leg out on the gas pedal and your left foot on the footrest, it puts your pelvis in a little bit of a left rotation, where the right side is going forward to reach out towards the gas. So you want to make sure that your seat is not so far back that you're really having to reach with the right leg. Moving your seat forward a little bit can help make it easier to reach the gas pedal without having to have your legs so straight where your sciatic nerve is on tension, or without having to rotate your pelvis to reach the gas pedal. Additionally, pushing your right hip bone back into the seat can help put your pelvis and spine in a more neutral position so that you're not putting so much pressure on the nerve roots. Additionally, you want to pay attention to the side-to-side position of your spine. Many people will tend to sit with their weight a little bit more on their left butt cheek when they're driving, and as a result, that creates a slight right side bending of their spine. Now, that right side bending narrows the spaces where the nerves to the right sciatic nerve come out. So putting your weight a little more on the right butt cheek or leaning your trunk a little bit towards the left side can help take some pressure off of that right leg, which again is typically the one that people get sciatica in when they're driving because it's extended out. Additionally, if you're on a long road trip, it is a good idea to get out of the car and move around a little bit, get some blood flow to your nerves, and give your spine a change of position. That way, when you get back in the car, you'll be able to drive a little bit longer without so much pain in your back, buttock, or leg. So hopefully you find these tips helpful to make it more comfortable the next time you're driving in a car. And if you need more help for back pain or sciatica, We've got lots of other tips in our back pain and sciatica playlist. But before you go check that out, if you found this video helpful, make sure to give it a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching, and I'll see you in the next video.